Hey guys, what's going on? Kevin Yates here from functionaltrainingcoach.com. Got another question from Kathy who watched the squat video I did about how to fix the knee pain from squats, and so the knees are feeling a lot better, but now she's feeling it in her, she describes it as her lower side back. So Kathy wants to know if this is normal for a 55-year-old. So I think that's an interesting question because number one, age does not matter, right? It doesn't matter if we're 55 or if we're 25 or 105. Where you feel the exercise should be the same all across the board. I think that's something that we tend to believe because we're told so much, by doctors and all these experts out there who talk about as we get older, all the things that are happening, like we're supposed to break down for some reason. And it's just not true. The problem is, when we get these imbalances in the body, it increases wear and tear on muscles, tendons, ligaments, and joints. It throws our movement patterns on, and it just really destroys the body over time. So really what we're looking at now, when you describe this as the lower side back, I'm going to go over a few things. So number one is like lower back. So if we're talking about like lower back, right along, the sides of the spine, right in there, like if you're feeling a lot in there, you really don't want to come off like feeling the lower back. I always say you don't want to feel the lower back. Now, to some extent, your lower back muscles have to work to hold your posture up. So when you're in a squat, the lower back's going to work a little bit. The problem is when people have so much lower back activity going on because the hips are weak, the abs are weak, and those muscles aren't helping to support the whole movement, then they tend to feel a lot of lower back. So what should not happen is that when you come off a squat, you shouldn't feel like you have to stretch your lower back, really feels tight. It shouldn't be that way. If that's going on, then there's just issues with, you got to strengthen your glutes and you have to strengthen your abs, basically. The other thing is like if it's not lower back there, if it's more like just in the sides back here, that's not too bad depending on what you're doing. So, a lot of times, like if you hold dumbbells and you're, doing like lunges or, deadlifting where there's uneven load, you can feel the sides, and that's just your obliques working. And those are muscles that are trying to keep you balanced so you're not going side to side. Anytime something threatens to pull you this way, obliques are going to contract to keep you upright. And they also work to stop this twisting motion. So if anything was to force your body into a rotation, the obliques counter-rotate. So that's what's going on there. That's not too big of an issue. Now, side lower back, if we're in between the two, so we're not back here, we're not on this side, but we're kind of like almost from the ribs down to about the hip, right around in that kind of area down in there, that we've got to be careful about because there's a muscle in there called the Quadratus lumborum. And those are muscles that are very prone to getting tight and causing a lot of pain and injury type symptoms, and they can really create a lot of problems in the body. So if you're getting things like that, again, some things you can do. One is just get that side opened up. If it feels real tight and you're getting a lot of it, what we want to do is we want to decrease the activity of it. They're muscles that are very prone to getting short and tight, and they get easily excited, so they're hard to switch off. So before you go into a squat, a good idea is to get yourself a big stability ball and then lay over the ball. So if you're tight on the right side there, you lay on your side on the ball, bring your arm over and stretch that whole side out. Other things you can do are holding a dowel overhead and doing like side bends, side to side, so or really just working the side that you're tight. That will help to open everything up. Again, though, it's kind of like the problem with stretching. Stretching doesn't really fix anything. It makes things feel better temporarily. It gives you a little bit more room to move. But the thing is that if you don't correct the problem in the body, like the imbalance, the muscles that are weak or the muscles that are tight, you really aren't working at addressing the problem. Over time, what's going to happen is you're just going to stretch, feel better, then boom, it's going to get tight. Stretch, feel better, get tight. Same thing what happens with people that go to chiropractors. They get put into place, they feel great. A couple weeks or a month later, they're back in the office again because they can't stay that way. So again, what it's coming down to is really addressing core stability, right? Getting your abs to work as stabilizers, not doing crunches and crunching patterns, because we don't want to end up like this. This isn't where you squat from, this isn't where you move from. We need to move up here. We squat up here, we push, pull, we run, we do things from up here. So this is where the abs have to be stable. and then also you've got to get your glutes and hamstrings to work a little bit better. So those are kind of the issues that you're dealing with. So again, to recap it, if it's low back here, problem. If it's QL, quadratus lumborum, a little bit of a problem in there. If it's just in the sides of the obliques, not a big deal. I wouldn't worry about that so much, okay? But I would worry about the other two, and if that's what you're getting, then address it. A little bit more glute activation type exercises, bridges, could just be like body weight type, squatting type, movements, things where you're sitting, laying on the floor, I should say, and doing movements, laying prone, squeezing your butt tight, just getting those muscles to fire, and then finally getting your abdominals to work as stabilizers, not movers with crunches, but stabilizing type movement patterns, all right? So hopefully that helps you out, and again, you guys, if you have any questions below, post them below, any injury type issues, let me know about it, and I will do a video down the road to answer your questions, all right? Take care.